myself this is a phase. And this is not motivational speech. This is me seeing reality as it is, because most of us have found a way to live in an illusion. You think this is not happening. You run away from it. You repress, and it is still there. Somebody will do something one day and you act out of, you don't even know that it's still there. You have this outburst and you are like, this thing, because you did not handle it when you should have handled it. So just go into yourself, tell yourself that this is a phase. This one will still pass, right? And you keep moving on. Praise God. So I'm going to pass the mic to physiotherapist Jidechku to continue from where I stopped.
Praise the Lord, church. Okay, I'm going to lay more light on, since you've been handling health, mental health, and every type of health. So I'm going to specifically talk about cardiovascular health. So whenever we talk about cardiovascular, cardio means heart. Your vascular means your vessels. So cardiovascular. So every health, this is just your system that has to do with the proper functioning of your heart and your vessels. So you actually need to know what is the function of the heart and these vessels. So their function is what? They actually transport blood, oxygen, nutrients to your tissues. That you are functioning, that I'm functioning, is that my heart is working. Understand? So if my heart is not working, I am actually, in fact, I cannot be here. My heart is not working. It's not the one of heartbreak, or not that one. The normal heart, please, that we're talking about. So, so if your heart is not working, it's, and the heart, as I told you, it actually pumps blood. It receives blood. That is the work of the heart. It receives blood, deoxygenated blood, and actually pumps out oxygenated blood. You understand? So oxygen flows through blood that you are breathing in. It's blood that carries the oxygen to your tissues, that your muscles, that I can raise my hand, that I can talk, that I can look at you, that I can do certain things that you do. Every particular thing that you are doing is the blood that flows, that the oxygen in the blood that actually flows through all those things. You understand? So, and not just the oxygen, both nutrients in your body. If you eat and your body, the nutrients your body needs, it's actually the blood that passes through, that, that transports it throughout your body. You understand? So, what do we say when we say that this person is cardiovascularly, let's say, sound, or we are well? If they check your cardio, they say you are well. Maybe they checked your vitals and they say, okay, this is you, that you are good. So there are some parameters that you should know. You should know it. It's not just that first before you check here. You understand? You should even have some kits on your own. You understand? To get it, your blood pressure check, you can even learn how to check your pulse. That is your heart rate. So what is the parameters that we have to, for your blood pressure? There's something called systolic and diastolic. Understand? So that time when you see people writing maybe 100/8, say give blood pressure, no, 124, people that actually checked their blood pressure today. Thank you so much for actually checking your blood pressure today. It's actually a wonderful thing that you put it. So you can clap for yourself. It's not everybody that they tell check your blood pressure that normally check their blood pressure. There is that anxiety, and it actually causes high blood pressure too. Yes, that they say go and check your blood pressure causes high blood pressure. You just, and when a nurse or anybody's checking it, they'll be like, are you okay? But you are okay normally. You understand? I know it happened to some of us here. So when we talk about high blood pressure, we're talking about the systolic and the diastolic. And for the systolic, it has a range of value. So the range of value is within 90 to 130. For the systolic is the one above. You understand? Then for the diastolic, it's actually 60 to 90. You shouldn't pass it. You shouldn't pass it. Anything that you are checking that is below this number and that is above this number, you're actually in trouble. And when I mean in trouble, that does not mean that when you check your blood pressure immediately and you see that your values are high, you now say, I'm now okay. Let me put it this way: there's something called hypertension and there's something called hypotension. You understand? So for you to be diagnosed of hypertension, you have to have been checked not once, not twice, not thrice, not the fourth. Like you have to have been checked regularly for them to say, okay, this is a hypertensive patient, or this is a hypotensive patient. You understand? I've already checked your blood pressure again once. So say, BP abiakwa. Need this ibuko hypertensive. You just 10 years ahead. You understand? So there are things that you can actually. Okay, I'll still go down and talk about that one more. So also talking about the parameters that you need. Okay. Can we acknowledge Papa for just thank you, sir, for actually honoring us. Thank you very much, sir. So let's continue. For the heart rate, there's something that you actually call heart rate. Heart rate is the amount that your ball plunges, like your ball that your heart pumps in a minute. You understand? So the amount of pounding, maybe you're touching your heart, is doing boom. You can just touch and just check. I know everybody knows you can just touch and just check. In a minute, you understand? It has a range within 60 to 100. You understand? 60 to 100 beats per minute. You understand? So anything above it, you are in trouble. For an adult, they actually have one for babies. You understand? And they actually, even as you are getting older, the number actually changes. It changes. So at least for an adult like me and you, it's within 60 to 100. Nothing more, nothing less. Please. So I think that is that. Then adequate oxygen delivery. That is how you actually know that you are working. As everybody is looking at me and listening, and everybody, that shows that at least you're part of. If you cannot raise your hand again, that means maybe you wanted to do something and you're not feeling strong. You understand? It can actually be related down that you are having maybe low blood volume, and from low blood volume you now start tracing it to low oxygen. You understand? And all of those things. And also, when you are not able to exercise, do physical activity. You know, there is something called exercise. If we have time, I will just deliberate or talk about it more. Exercise is not nanchoi jafia, it's not exercise, please. Or maybe nanchoi jeme. No, it's not. Okay, let me just talk about it now. Exercise has to be timed. If anything you are doing is not timed, one is not exercise. Then it has to be tailored to you. You understand? The exercise that I can do is not the same exercise that she can do. It's not the same exercise another person can do. It has to be tailored. You understand? So, and it also has frequency. It's not like I'm doing like, okay, let me say I raise my leg 5 times. You understand? And another person has been raising his leg now, that is now exercise for the person. Because I timed my own, it also has frequency. And there's a technique I'm doing with it. That means it's not exercise. It has to be it has to have procedure. Without that procedure, it's not an exercise. So when your like, why cardiovascular health matters, why it matters most is that there are actually conditions that arise that when you don't have a good cardiovascular health, or there is ill health. So you see stroke. Stroke is one of the most leading cause of death now. A lot. And it's not for old people. Young people actually have stroke. I treat when I mean young people, I think I have a patient of 18 years in the hospital currently. Like stroke. And we don't just have stroke we also have stroke in babies. We call it pediatric stroke. So not just every stroke can happen to anyone. Understand? So, but it might not be just blood pressure that causes it. But for an adult, for like you and me, it is blood pressure is one of the risk factors for it. You understand? So, talking about it, you can have hypertension, you can have heart diseases. Understand? You can have heart failure, and so on and so forth. So, how can we prevent this? It's actually preventable. You understand? How can we prevent all this? One is, as I said, I can't out there physically fit ever. I don't know how many of us came out this morning to actually get fit, or even, and yes, maybe many of us came out, but how often do you do that? That is another thing. You understand? Overall, as a kawaii open now, oh yes, members. Everybody needs hey, will now go out. But seriously, it has to be like now for me. There was a time in my, let's say, when I think after my schooling, I took this time, and from my home, I was running to Opera School every morning. Like, I think I did it for like 5 months. it was on a steady. On a steady, I was every morning from 6 to 8. That is going out, going out. I used to do it until like now I've minimized it because of work and everything. Understand? But that was just my life then, because I don't normally do anything in the morning, early morning hours. But now, if you're relate, you're on your own. So that is that. Then poor dieting, we actually eat very poor in this part of the world. I think we eat very poor. Like people that drink canned drinks, please. High sugar content, high salt content actually causes high BP. You understand? So we have to actually tell her down on these things. Like tell her it down. If you cannot in fact stop it. But if you cannot stop it, just control it, please. It has to be controlled. Yeah, I know now. Paro Coke, Paro Pepsi, with bread, everything, aga. You understand? Then high salt content is not just in food. There are things that you eat. Maggi, you know Maggi has salt in it. Indomie I need Indomie generation. You understand? So please, we have to cut down. And many canned things that we normally use to cook and eat and everything, please, they contain salt. They use it for preservation actually. You understand? And with preservation, you just recall routine and am I here? You understand? So that is it. Then naturally, I just should mention this one for people watching. I know none of us here actually takes alcohol and smokes. You understand? Amen. But for our viewers and everyone, I am sure nobody here does that. So, but it's actually a risk factor. It can lead to it. It can damage your heart and everything. So, then obesity, makandi buribu, makandi biko. Please, you have to tell her down on your weight, and that is how you have to be physically fit. Because in exercise, you're not about that. So I think I've laid more emphasis on this, and please, also family history can actually lead to it. If you have that is the one you cannot change. Age, they are non-modifiable, but the others I have been mentioning, you can at least work on it. But age, as you are getting older, you know your body systems are actually getting older with you. So those things can actually cause the risks of it. Then, as I've said also, now you understand? The rate of stress we have as young people is too much. The stress is too much. You understand? No, they take your sleep. No, they play with your sleep, please. No, they play with your at least 6 to 8 hours of sleep in 24 hours. Seriously, serious. I know it's hard because I know Chiego. Everybody's trying to make ends meet. You understand? But please, let's tailor it down and have a good night's rest. Because when the guy outside in the morning hours, someone like me actually, I'm trying my best. Then you actually have to read. As a medical practitioner, you have to steady reading. And every time a go will continue going the next day. So it's always hard for us and many like in many professions also. So I think with this, I will end on this so that the next speaker will talk more. Okay.
Yakubu manage. So I actually just picked up the microphone because I don't like the way we're seated. I'm seeing people sitting outside. I just want to correct that sitting. JT, fill up the seats in front. Let's sit properly. Alright, we may not be so many, and it's quite understandable because I think because a lot of people came out in the morning, it's going to be a bit difficult. So I don't like that whole sitting arrangement. Let's so that we sit like orderly people. Leonard, move forward. Yeah, some to forward like that. Yes. This sitting arrangement makes it look like we're serious people. I know we are serious people, but it's the way we sit to look like we're not serious. Amen. Thank you. That's just what I wanted to.
Okay. So just to, my own, I'm going to be talking about vital signs this evening, firstly. But just to add to what he said about dieting and all of that. sometimes you don't necessarily have to pick salt and some of these things from just the food you eat. He mentioned it as well. It can be in the drinks you take. It can be in some other junk as well that sometimes we don't even look at the dietary um, value of some of the things we actually take. You just take and consume. Just pick and consume. That is very wrong. If there's something that is on the rise in the past few years amongst young people, is a condition called nephrolithiasis. It's all about, it's kidney stone. Let me put it like that, kidney stone. Sometimes you don't even know that these things are actually developing because there is you don't take enough water. Sometimes, I mean, stay hydrated with us, yes. So water has a vital role in the general running of our body, in blood pressure, in regulatory, every single, there's nothing you want to think about in your body now that there is no input with water. Even on the surface of the earth, how many percentage of water is the earth now? 70. The whole earth, 70%. So you think about it, that even God that made the earth and made it of 70%, you would have to know that water is very vital in the running of our daily lives. Thank you. So I'm just going to talk about vital signs. Vital signs is basically the function, general function of everything in our body. And it's been noted, let me use it, a proper definition, an objective measurement of the essential physiological functions of living organisms. It's the basic function of your body, basically. So there's nothing you want to know now. If you come to the hospital now and you are saying, oh, I feel this way, I feel that way, I feel a certain type of way, nobody is about to touch you or diagnose you of anything without first ascertaining your vitals. Vital signs are very important. Now, what are these vital signs? We have the temperature, we have the blood pressure, we have the respiratory rate, we have the pulse rate, we have your blood sugar, we have your blood oxygen, and we have your weight. They are 7 in number. They are very vital. You can't do without these things. Now, these things actually vary in range. Yes, they don't have there are some have specifics, but then they also have ranges. And this thing, why they have ranges, is because it can differ in age, it can differ in size, it can differ in region. Yes, so we now that in hot regions like Nigeria, you can see that your temperature can be a certain level from someone that is experiencing winter in, you get what I mean? So these things they vary now in different, it has so many parameters to determine what this thing is. Yes, so it has a name, vital, as their measurement and assessment, as a crucial first step for any clinical examination. And like I said, normal ranges from age, BMI, body mass index, and other factors. So now we're going to be talking about the first one, which is the body temperature. Yes, the body temperature of a person varies depending on gender. Very important as well. What a guy can have as his temperature will be different from what a lady will have as her own temperature, irrespective of age. Yes, sometimes it can be when she's in her ovulatory stage, her menstrual phase. There's a slight difference. Yes, even when people are pregnant, you see that this, and it's not as if because, and this is as a function of hormones. It's not because there is something wrong with the person per se. They're actually very normal, and that is one way you can know that, okay, there's something going on with me right now because I'm at this phase of my cycle, and this and this and that is going on. That is why it is very important that as a lady, sorry I'm talking to the ladies now, I just had to say it in passing. As a lady, you need to know your body. Someone cannot be telling you about your body. So even if they're telling you, you confirm, yes, this is what it is because I have experienced it, and this is your body. Yes. So for the temperature now, it can range from, if we're using Fahrenheit now to measure, it can range from 97.8 to 99 degrees for Fahrenheit. But most times what we are most conversant with would be degrees Celsius. And it ranges from 36.5 to 37.2. So anything below 36.5, maybe we'll call you cold-blooded animal. But we're not cold-blooded now, Abby. Yes. But if it's higher than 37.2, it's an indication that there is a problem. Yes, there's fever now in the body. And if it exceeds something like 40, it's not just called fever now per se. Pyrexia is very dangerous. You can even see people convulsing person from having overly high temperature, and that is a problem. So we also need to know how to help her. It's not right to put your hand in somebody's neck or head to know that their temperature is high. Your body might be cold. It can be that your own body is cold. You get what I mean? So if your body is cold and someone's temperature is even normal, to you it will be hot. Think about it. Yes. So your own body can be cold. And sometimes that temperature may be actually high, but their body is cold. Why? The fever is internal. So you need a thermometer to ascertain what the person's temperature is. And we have thermometers ranging from different levels. We have the one that we put orally. We have the one we even put in the ear. We have the one they put in the rectum. That's the anus now, yes. They put there. There's some you put in the axilla. I like to think that that's the one we are more conversant with. You put in the axilla, under the arm. Yes. And these things they have wide ranges. But it's important that we know of them. So you don't go and put your hand in somebody's head. Someone's neck can even be cold, but their head is not. You get, someone's head can be hot, but their neck is not. So you cannot ascertain someone's temperature just by touching. But when you see that someone's temperature is high, these are things it's also good that we know some of these things because we can control it ourselves. If someone, I said, like I mentioned earlier, what's the range in Celsius for temperature? 36.5 to 37.2. So if someone is having 37.3, 37.4, instead of rushing to go and give maybe an antipyresic with something like paracetamol or something, you can just step it sponge or open them up to air. Think about it as a pot that is very hot. If you are trying to cool your food, yes. If you have a hot food in a plate and you're trying to cool that food, what do you do to it? Expose it to air. The same thing with the body temperature. Expose it to air. Don't crowd that person up. Don't go and, sometimes when we are sick, we're having malaria or something, because we are feeling cold and our temperatures are, we'll go and cover ourselves. That is wrong. If you cover yourself, I promise you, your temperature will shoot up. And that is, open yourself up to air. I know that the cold is there. I'm sorry about it. But you're making it worse by wearing a pullover, a sweater, a blanket over yourself. So expose yourself to air. Help yourself out by controlling your body temperature. Because one thing with some of these things that they may look so small, but they are very significant. Because in a matter of minutes or seconds, something can shift. And then someone is convulsing, someone is having issues, they can't stand properly, and all of that. Yes. So this is what I have to say for the temperature. So if it's high, it's called hyperthermia. Yes, if it's high. But if it's low, when you want to hear hyper, anything hyper is high, anything hypo is down. Yes. He mentioned hypertension. We know we know hypertension now. We hear high. When you just say that hyper, it's high. But when you hear hypo, it's low. So if they tell you hypertension, high, hypotension, low. Hypoglycemia, low. Hyperglycemia, high. Think about it like that. Yes. Thank you. Thank you. So that is that for temperature. We'll be talking about the pulse rate now. He also mentioned the pulse rate. This is now what we are going to delve into what he said a bit. The pulse rate is a measurement of the heart rate, the number of times the heart beats. The number of times the heart beats per minute. Yes. As the heart pushes blood through the arteries expand and contract. There's an expansion and there's a constriction from the heart, yes, with the flow of blood. Taking a pulse does not only measure the heart rate, but it can also determine our heart rhythm and the strength of the pulse. If you're someone that is very conversant with checking the pulse, sometimes you notice that you can check one person and he's doing boom, boom, boom. Sometimes you check another one, he's doing boom, 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 boom. These things are different. The strength of the pulse, and these things, just like I earlier said, it varies in people, different people. It can be from activity. Someone that finished running now, you don't expect their pulse rate to be boom, boom, boom. Of course not. It will beat high. Am I correct? Yes. So these are what we need to take note of. Now, what is the normal pulse of a healthy adult? Like he said, ranges from 60 to 100. 60 to 100. So anything below 60, of course now, the pulse has gone down. Anything above 100, the pulse has gone up. Yes. And these things, why it's important that we know these things is because these are indications of life. One of the things they'll teach you in the hospital when if you're working there is that when a patient presents, maybe an emergency patient comes, you first assess vitals. You don't admit a dead patient already. So as they're outside, you check their vitals. If you can notice a sign of life, that's why they are called vital signs. So they can shift quickly, they can stay quickly. So you need to be very sure of the patient's well, not patient now. We're talking to ourselves because we need to know these things for ourselves. Yes. So the pulse may fluctuate and increase depending on exercise, illness, injury, and even emotions. If they break your heart, you get what I mean? Hmm. If someone is, even if you're too happy, think about it. If you're too happy, your emotions are everywhere. And you can have that excessive heart rate and all of that. Does not mean that you are now having a problem. No, it's because of what happened, the situation that just passed at the moment. You get what I mean? Now, in females 12 and older in general, they tend to have faster heart rates than a male. Yes. Athletes too, they also tend to have um all these people that have that engage in cardiovascular activities. You may experience this. Does not mean that they are now above normal. You get what I mean? Now, how do we check the pulse? This is also very important. Sorry. How do we check the pulse? You check the pulse with these two fingers. You don't check with this one. Now, your radial artery is somewhere around here. Can you see me? Can you please? This is very important to note. Your radial artery is somewhere around here. Yes. So you don't check with your thumb. If you press someone's radial artery now with your own thumb, you probably may be counting your own pulse. So that is wrong. You probably will be counting your own pulse instead of counting theirs. So you check with these two. When I say radial artery, there are two bones here, the ulnar and the radius. So the radial artery is somewhere around here. So the artery, you press on it firmly, but not with force. But it should be firm. Yes. You press on it with these two, and then you can feel it palpating. Boom, boom, depending on what you do. You get what I mean? So you can either check at the radial artery or you check at the brachial artery. Somewhere up here. It's here. If you calm down and press it firmly, you feel it here. The brachial artery is somewhere here. So this is how you check the pulse. Yes. So you press on both arteries. It's located close to the surface of your skin at certain points of the body. Now the pulse can also be found on the neck. You know your jugular now. This jugular, yeah, it's an actual thing in the body. Yes. That's why I want to break the devil's jugular. Yes. It's an actual thing in the body. It's somewhere on your neck. And these are very important, vital points. Anything that happens to your jugular, there's no saving. There's no saving it. It's gone. Yes. So your neck too is very important. If you do anyhow with your neck, your jugular can be affected. That is why we are aiming for the devil's jugular now. Once pay. Yes. So, and it can also be checked on the elbow, like I said, the brachial artery, and where now? Sorry. And on the wrist, the radial artery. For most people, it's easiest to take their pulse at the wrist. This is the most easiest place to check the pulse. Most times you see that when they want to check your BP, they put it here. That is because it's also easier to hear it with the stats from this place. But to check the pulse, it's easier to place your hand on this place to check it. Yes. And if you use it, okay, this is beyond what we are counting for. As I said, now pulse rate is, the range is what? 60 to 100. I would like to think that we are following. Yes. So this is 60 to 100. So we're going to be talking about the respiratory rate now. What is the respiration? Now, just like it says, respiration. We're just counting how somebody breathes to check if they are breathing well. How do you check it? The rise and fall of the chest. If you are breathing, how do you breathe? You see that one thing you notice that there's upward movement, downward, up, down. That is how you count. When you count the up, down, you count it as 1 over 1 minute. So sometimes you may not have all the time to check it at 1 minute. You can just count as 15 seconds multiplied by 4, or count at 30 seconds multiplied by 2. You get. But one of the things you do is that you check the rise and fall of the chest. Yes, the rate is, I don't think I mentioned what the rate of pulse is measured in. Is measured in beats per minute. Beats per minute. So when you say my pulse is 60 words, perfect. 70 perfect. Yes. So the rate is usually measured when a person is at rest. So you cannot be checking someone that just finished running their respiratory rate. It will be high, and then that's an error. You read it as tachypnea, and that is wrong. So you have to make sure that they are at rest, and it usually involves counting the number of breaths that that person has for 1 minute. Yes, by counting how many times the chest falls and rise. Exactly. So respiratory rate may increase with fever. Have you experienced this one before? If you're feverish, sometimes it feels like you're not breathing properly. That kind of thing happens. So it can come with fever, it can come with other illness, it can come with so many medical conditions. And now, what is the normal rate of respiration? A normal rate of respiration for an adult at rest. Adults, listen to me carefully. Adults at rest, it can range between 12 to 20. At rest. Yes. At rest. Then, if this person now is, even sometimes you can even see some school of thought will tell you between 60 to 20, but this is the range. This is what it's like. So, if someone is having respiratory rate of 20 to 25 at rest, it's an indication of a problem. Does not mean that someone who is normal, that maybe at rest they would have had 12 to 20, maybe when they exerted energy, if they have between 20 to 25, does not mean that they have a problem. It's just because there was an exercise. Even sometimes if you walk up these stairs, you notice that at that point it's a problem. For people that are not exactly, you get what I mean. So sometimes it's a problem. Or maybe you go up the flight of stairs a few times. These things actually happen. Does not mean that you have a problem. So, but check yourself at rest. How many would my respiratory rate be at? Yes. Then if it's below this number at rest, is an indication of brachypnea. That's a problem. It's brady, it's low. It's a problem. Because once someone is losing respiration, I mean, you can't breathe well. What do you think? The person is going. So immediately there should be interventions for the person. Yes. So we're going to be talking. Okay, just like I said about normal range for adults. I said these words. How many is it now? 12 to 20 years. Now for newborns, the child you just gave birth to now is a newborn. I'm sorry. Yes, that's a newborn. They usually have higher respiratory rates. So you don't go and see them breathing hard and you think that they have a problem. No, it's their normal life. It's their normal life. Yes. If you have experience with newborns, you can tell what I'm saying. Sometimes some new mothers, they will see their babies breathing hard and they are wondering, hey, what is the problem? It is just what it is. It's usually between 30 to 60 per minute. They breathe, yes. Another thing you should know is that some of them are still learning to use their body well. Even when you bring them out, they cannot suck well. It's not automatic. You have to introduce it to them first to suck. They will now learn that, okay, there's something that they need to on. That same way their body too is adapting to so many use of their organs, so many things. So don't be in a hurry to rush them and go and put oxygen for them because they are fine. They are fine rather. Now for toddlers, they usually range between 24 to 40. Yes, you see now, if you know, what do you notice? It's coming down. It's coming down because they are growing. They are learning to use their organs. So it's coming down like that. They are beginning to adjust to so many things. And if you know toddlers, if you're very familiar, they play a lot. Their energies are over the moon. So you know that these things are actually very normal with them. Then school age children, it can range between 18 to 30. See now, what's it doing? It's coming down. And then for adults, is 12 to 20. So if an adult is 20 to 25 at rest, is an indication of a problem. Yes. Now we're going to be talking about the blood pressure. The blood pressure is the force of the blood pushing against the artery walls during contraction and relaxation of the heart. Each time the heart beats, it pumps blood into the arteries. So that thing that your heart is beating, what is it doing? It's pumping blood in, it's also pumping out. It's sending oxygenated blood to the rest of the body and it's receiving deoxygenated blood, right? Sorry, what am I saying? It's pumping out. Yes, I'm correct. Yes, forgive me, guys. So when the heart relaxes, this blood pressure can fail. There are two numbers that are usually recorded when measuring blood pressure. The higher one, the one on top, is called the systolic number, and the one below is called the diastolic number. Yes. So the lower number or diastolic refers to the pressure that is inside the artery when the heart is at rest and it is filling with blood. Both the systolic and blah blah blah, these things that I'm about to say, you may not exactly, but what I'm just trying to say is that there is a higher number and there is a lower number, and this higher number and lower number have a range that are supposed to be at, and that is what is very important to us now. Now, a normal blood pressure of an adult would be 120 over 80. So if you have 120 over 80, you're very good to go. Does not mean if you have 110 80 that you have a problem. You get, if you remember what I said earlier, there will be a normal number that these signs are supposed to be at, but they also have ranges. Yes, because it differs in what age, it differs in person, it differs in gender, it differs in state of the body. A woman that just finished seeing her menses, you don't expect her blood pressure to be at 128. It can be 110 80, 110 70, because something just happened. You get what I mean. So when the blood pressure is high, it's called hypertension, and when it's low, it's called hypotension. Thank you. If I catch you now, please clap for yourselves. So now this number that I just gave you now is only but a guide. Does not mean that if you check your your blood pressure in one day and probably it's 130/70 or 130/80 that you have high blood pressure. So you would have checked it over a few days. You get at rest. Note, at rest. You cannot finish climbing up the stairs now. Tell me you want to check blood pressure. You cannot, never, my lord. No, you will not. You have to rest. Yes, you have to rest. You cannot be pressed and be checking blood pressure. You will pee. Yes. Think about it. When you're pressed, what are you? Are you not under pressure? You're under pressure now, and you want to come and check blood pressure. Azal now. So, yes. So, these are things that you have checked over, a certain, and also another thing you can also try is to check over different machines. You can use the manual, you can use the digital, just to be sure that they may not give you exactly 120/80. The digital might give you 124/79, and the manual is giving you 120/80. Does it mean that you have a high blood pressure? No. You get what I mean now? So they have similar ranges, but they may not give you that exact number that this one is giving you and this one is giving you. So, yes. So now, why should you monitor your own blood pressure at home or at intervals? For people with hypertension, home monitoring allows your own doctor or your nurse or your caregiver to monitor how much your blood pressure changes during the day. Yes, and from day to day, this also helps your doctor to determine how effectively your blood pressure is working if someone has BP. Now, I'm now saying it now for some of us that have elderly parents that may have BP issues and all of that. So now, before you check your BP, there are some things you need to know. So I like to think also that most of we here, we don't smoke or drink. Yes. We don't. Do you drink coffee? Let me ask this one. Do we drink coffee here? Okay, some people drink coffee here. So if you take coffee, after taking your coffee and you want to check your blood pressure, don't check it immediately. It spikes. Yeah, it spikes. It was going to increase it. So you check 30 minutes after. By that time, it must have, settled in your body or something. Not as if it's going to wear off immediately, but to an extent, there's a settling there. So you must pee before checking your blood pressure. You relax for 5 minutes. Yes, and then also positioning is very important. There is nothing you want to do in this life that positioning is not going to help your life with. Yes. So we'll be talking about the weight now. Weight too is also part of vital signs. It varies in different people. In the guys, what you see in a guy of 18 years will not be the same thing you see in a lady of 18 years. Why is that? There is something called the bone mass. You can see someone that is as small as this, but when they check their weight, they are weighing up to 70, 80, 90, and you're wondering, what is the problem? But you don't know that their bone mass actually contributes to these things. So I like to think that so far we've gathered a lot, or to an extent, in a few knowledge on some of these things, right? Thank you so much for listening to me.
All right, thank you, Nurse Ruby. I want to use this opportunity to remind all of us that this health talk session is brought to you by Havila Home Care Nursing Services, and we run a lot of, home care services that ranges from medication management, wound care management, stroke management. We take care of the elderly as well. We can come to your house, give you your medications, your injections, and all of that. So do well to check the number behind the flyer you are holding and call us. Thank you. All right, so I'm going to continue from where she stopped, and I'll be talking about breast cancer, cervical cancer, and other health conditions. But before I delve into that, I want to bring to our notice that there are a lot of diseases, just like she said, nephrolithiasis and gout, diseases that you've never heard of, that is as a result of your lack of taking water. It might sound so cliche, drink water, but it's really important, right? Because I've had to take care of kidney patients, and it's not easy. Hemodialysis, peritoneal dialysis is not something that you would wish for your enemy, all right? And so, stuff like even liver issues, and it's really heartbreaking that a lot of us, we are happy to take paracetamol. We are very happy to take typhoid. We are even glad KNMG, malaria and typhoid. You get, and before you know it, people, because right now a lot of pharmaceutical industries, they don't care about your life. They want to make money. And so what do they do? I'm sorry, are we recording this? Please, I want to say something. Could you mute us for like 2 minutes? Are we? And through studies and research, we've come to realize that people who fast and drink a lot of water, you see that thing you say you have ulcer, you can't fast. It's a myth. When you have ulcer and you can stretch from 6 to 12 and you can comfortably drink a lot of water between 6 to 12, ulcer is a scar, an injury to your intestines. It will heal. The body has the ability to heal itself. If you eat well, drink water, and rest well. Yes, sir, rest well. Okay. So yes, go ahead. You can unmute now. There are a lot of cures for certain diseases, but because of money, they can't release that cure. So what do? Eat well, drink water, and rest well. Kudo bedrege. Do you understand? So stuff like breast cancer, cervical cancer, carcinogenic stuff that you enjoy eating, hot dog, has been proven to be carcinogenic. And you take 3 in just one shawarma. Exactly. And these are the things that when you keep taking them over time, they begin to destroy your body cells. And let me shock you, chemotherapy is not healing you. Chemotherapy is destroying your body cells. Any drug you take is foreign to your body. See, when God created man, he created man from the dust of the earth. And that is why when you take food, your body recognizes food. Your body recognizes fruits. Your body recognizes water. Because these are the components of your body. Do you understand? So when you take paracetamol, paracetamol is a poison taken in little dose that your body can handle. And if you do not take a lot of water, your body might not be able to handle paracetamol and it destroys your liver. You have orange everywhere, but you choose to keep taking vitamin C 1000 milligram. Why? You have pawpaw. A, a, a man of God once said, and I really believe in it, and I've been practicing it, and it has been working for me. Every fruit has a season. In that season, eat that fruit well. Do you understand? When it's time for udara, lach udara. When, when it's time for pawpaw, eat pawpaw, eat mango. When the season is over, you know the season is over. Eat well and just drink water well. Disease like gout, this carbonated drink, I hate carbonated, like I hate it so much so that the people around me, they don't like, you cannot comfortably take Sprite around me. You, you get, because I was studying, because I run in my WhatsApp channel. I teach every Friday. I pick a particular health topic, I research on it, and I teach people. Okay? And during my research for gout, we noticed that fructose, yes, sugar, they are part of the stones that when your body is not able to excrete, it stores up. Certain drugs that you take, when your body is not able to excrete it, it stores up. And you don't drink enough of water. How do we help you? You see, God has called us as Havila. We administer healing. And the healing we administer is not receive your healing in Jesus' name. We do that and we give you knowledge so that you can live. Because God is the person that gives us money. And there are certain individuals that we've talked to, we've spoken to, therapeutic communications, and they just pay you. So instead of going about thinking that can you work with 50,000 to kill that person, because we just do what we do, because we understand that it is a ministry, Jesus finds a way to pay us, and he pays us well. Trust me. And not just financially, because okay, I'm here. All right. So carcinogenic stuff, when you take, okay, for cervical cancer now, as ladies, you know what the cervix is? I know the cervix is the opening to your uterus, your womb. Now, when this cervical cancer starts, it begins to deteriorate the mouth of your womb. And before you know it, it metastasizes and it spreads around your body. So, we found out that taking most of these hormonal drugs, these family planning pills, contraceptives have been found to be one of the leading causes of cervical cancer. You take it too much, bro, you're gonna land yourself Cervical cancer. Early sex. I know this is a church, but we bring you truth as it is. So, you know, and having sex with a man that has HPV, human papilloma virus. Do you understand? So the fact that you do not have it, but go, when we were having the HIV test, people like don't test me for HIV. I just laughed. They are dangerous, more dangerous diseases than HIV. You see hepatitis, you are walking around near Chiaru, collecting saliva, collecting sweat. It's even you. I mean, herpes too. Very dangerous stuff out there that you should know about. So please, I was discussing with my friend 2 days ago, and I began to laugh. And she was like, "Why are you laughing?" I said, "What I'm thinking now is the money to use and run Havila." And she was like, "Nah, that we've grown, no. We are not thinking, am I pregnant? Beyond am I pregnant, have you contracted gonorrhea, chlamydia, HPV, and the rest of it?" So you see that abstinence brings you peace of mind. Okay? So that exposes you to HPV, which later on, because these things they don't present that day. Okay, my last posting at UNTH Oncology World, we saw girls 16 years, 17 years, 18 years presenting with cancer, cervical cancer. How? So these things, when he talked about pediatric stroke, it used to be scarce in the days of our fathers. You don't hear these things. But because now we like fast food, we want to eat Indomie, you don't even parboil it, you just cook it and eat it. Indomie takes 3 days to digest in your system. So you see, you are not doing yourself any good. That fasting will go to your body and rest. So it's not even like the fact that you are not taking alcohol, but you are binging on carbonated drinks. You are killing yourself. You are not taking alcohol.
This Sprite, Anna the instrumentalist na church. She is na supply them water. Water.
All right. So thank you, sir, for that. So you don't binge. You don't rub Peter and pay Paul. You don't say you are drinking a lot of water. By the side, you're also taking a lot of carbonated drinks. You don't say, "Okay, I'm drinking a lot of water. I'm not taking carbonated drinks," but you're taking noodles, sharp food. You are eating hot dog. You are taking a lot of carcinogenic stuff. And even this, there was a day Keke was driving us down to Kenneth, and at some point he just drove, and the exhaust pipe from the big car was I was like, "Oga, you drove us all the way from Holy Ghost to come and park us here to die. Like, what's going on here, sir? Please, can you take this stuff down a bit so that we don't keep perceiving this thing? It damages your lungs. A lot of cancers has been found, but we don't know about them because we don't even just imagine the number of people that came to hear about their health today. But if somebody comes to me and say, "No, ciprofloxacin," the person will now say, "Oh, no, sir, more." But if you tell that person, "Go and drink water, sleep well, and eat well," or say, people prefer to die than to live. And that's the reason why people, heartless health workers, can stay on that, leverage on it, and take your money. And I'm sorry, even if I'm there, I can't talk, because most times they are your superiors. So you just keep quiet as if you don't hear it. And because even if you go and tell that person, the person will implicate you. So allow the person to die peacefully. Sorry for that, but it just has to happen. Either ways. So breast cancer, as ladies, please, it's important that 14 days after your period, right? You go to the mirror, check your breasts. It it's important we say these things in church because most of these people in oncology, you see their big Bible on top of their beds, but they couldn't do the little things that they should have done. And it's annoying. It's heartbreaking. Sometimes you come, you're doing wound dressing, you're crying. Cancer is painful. So you go to the mirror, you check the size of your breast, you press it to check for lumps. If you if you happen to find lump, please go for ultrasound. Let them check if it is benign or cancerous. And if it is benign, please let them operate on you or ask Papa to lay hands on you. And it leaves you, or you go for proper surgery. They take it up, take it for biopsy, and be sure that you're on the safe side. We are no longer in that era where things do not have prevention and things cannot be handled properly. It depends on what you are doing and the kind of informations that you give yourself to. So please, carcinogenic stuff, sleep well, eat well, rest well, take a lot of water, and just avoid carcinogenic stuff entirely. And as ladies, to prevent cervical cancer, no sex, because enjoy your life as a single woman. Abstinence gives you peace of mind, believe me. And stay away, even when you get married. It's better that you go to a counselor. You can meet Ruby, you can meet myself. You can meet me rather. We take you through counseling sessions and you get to choose the family planning that you want. Instead of rushing to go and take Postino 2, and you keep rushing and rushing and rushing to take Postino 2 to the point where you are just 30 years old and you are bleeding. You know that stuff that happened in the Bible, the woman with the issue of blood? That was cervical cancer. Yes. So please, actually research, I'm not adding to what the scripture did not say, but from research. Okay, so do well to eat well, sleep well, drink a lot of water, and avoid. My friend wanted me to get him shawarma. I'm sorry, we cannot get to shawarma. We'll give you water. Alright, yeah.
Okay. Still on breast and cervical cancer. One thing, just Jay said something when he was talking. There's some things you cannot rule out. What is that thing? Genetics. If it's something that was in your bloodline, you cannot rule it out. That is where what nurse said now comes in. Make sure you always check. Breast self-examination is something you cannot rule out as a lady. Like I earlier said, someone cannot be telling you about your body. You need to know your body for yourself. Yes? Yes. Now, in cervical cancer, abstinence obviously is the best. Even for anything, if you want to get pregnant, how do you not get pregnant? By staying away. Yes. So the same thing with cervical cancer now. Now, we are saying abstinence, but there are two ways to these things. One is that someone, maybe before they gave their life to Christ, they were sexually active. Yes? If they were sexually active, what do you do? This human papilloma virus has a vaccine. Yes, it has a vaccine and it has a test. It's called the pap smear test. Yes, but you don't take that vaccine without first checking if you have the virus. Now for every virus, when you hear vaccine, it's not as if it's cure or something. It's that particular thing you're trying to stay away from is that same thing they are giving you, but the virus has been inactivated. Let me put it like that. It's not active now in your body. So when it's in your system, your body does not see it now as an antibody, because it's that same will I say condition, but it is inactive in your body. So you first have to confirm from the pap smear test that you don't have this HPV already. Now, when she was saying it too, why cervical cancer is very dangerous, because it's one of the very prevalent ways it occurs is from the presence of human papilloma virus. Why it's very dangerous is that you can see a young girl, sometimes you're seeing young ladies, like she said, or small girls of 18 to 30 in the hospital with cervical cancer, and it's traced back to HPV. Why is it like that? Maybe when they were younger, some of them, maybe it was from a pedophile, at all these pedophiles that did what they did to them, or it was from rape, or some of them were actually very sexually active when they were younger. So because they didn't know, and the guys, and even the guys too. Now a guy can have human papilloma virus and he does not know he has it. But it's worse in the ladies because it can take 10 to 15 years before it shows itself. So you would have bred, it would have stayed in your body, not in your body now, in the person's body to feed, to enjoy itself before it starts showing you signs, and you cannot do anything about it. Yeah, it has come to stay at that point. So it's important that as a young lady, you take the pap smear test, especially if you have been sexually active before. If you've ever been sexually active, please try and go and take that pap smear test. Now know that, okay, you don't have it, you get, and then abstinence, take the vaccine, then abstinence rules this for you. Yes. And you don't go, I don't know. Well, even though, yes, they say the Bible did not say we should not kiss, share, but truly, what are you kissing for? You can go about kissing, and herpes. You don't know that someone has herpes. It's a problem. From there, you did not have sex, so yes, you did not have. There was no penetration, but now you've contracted something that you don't know about because, yeah, it does not go. That's why it's even more scary. It's still there. Gonorrhea, they go anywhere. You just suppress it. They just all that thing they're doing that they cured it is not cured. It was suppressed. It's still there. So these things are very scary. And sometimes why it's also more scary is because sometimes people that have this thing, they are very unsuspecting. You get it, but you don't know. Because you were unassuming. Oh, you thought that this person, even some of the people that give it to you, they don't even know they have it. There are so many people, when we are on community posting then when I was in school, there are so many people, so many women that are pregnant, they come to the hospital to deliver their children or for antenatal, and then they are telling them that they have HIV. It's heartbreaking that you did not know. It's not you that went out to go and collect it. You have been with your, but then you cannot also tell, you cannot tell about your, especially for people that don't now, obviously that's why it's also very important that you listen to the Holy Spirit and counsel before you get married. You don't just up and about and pick any random person because you feel he's a fine boy or she's a fine girl. There are things that you listen to. You listen to details that were said, details that were not said. Please, cervical cancer is that bad, and it is the second leading cause of female mortality in the world after breast cancer. Breast cancer does it as number one, but cervical cancer is leading. There's almost no, but it is very high. And why it's very bad is that it will take years before you know. So please, are you a young lady here? As long as, even if you have not been sexually active, or even if it's once, even if it was half, please go, please go and check. Please, and rule it out. It's better you rule it out and then it's not there than you don't know, you're unassuming, and then it's a problem for fertility in the future. Because once anything affects the cervix is the mouth of the womb, the uterus. Once anything affects that thing, anything you're doing upstairs is you're not serious. That's the truth. Anything that's happening up there is not, and then it affects the vagina too, because after the cervix you're seeing the vagina and then the orifice. I don't want to go into details, but think about it like that. Once anything happens there, there is almost no saving for the rest of the guys because this thing has spread. So please, let's take note of this. Thank you.
And thank you so much, Nurse Ruby. Okay, and when we say these things, it's mostly basically on the ladies. Please, as a guy, we need to make sure that the boy child takes this vaccine. The vaccine is available for both the girl child from 9 years and above, boy child 9 years too. Okay, so at that 9 years, you are not sure whether the baby, let's give the child benefit of doubt, so maybe things and things, but yeah, the vaccine, and the guy too, protect the boy, protect the girl child as well. Okay, and the next thing I want to also talk about, I forgot to say it in the initial topic about your mental health, was about some neurotransmitters and hormones in the human body, because your body is very complex but you don't know. Okay, so we have to be kind to people. Something like acetylcholine, okay, let me start by saying that they are neurotransmitters. These ones are found in the nerve cells, the neurons, your brain. They send sharp signals to your brain. And they are hormones. These ones are found in your blood. they take their time to get to target organs before they walk. All right. So acetylcholine has a lot to do with your memory. When it's down, you are depressed. When it's up, your attention span is retained and all of that. They are saying that this generation has maybe this generation has short acetylcholine in their brain. Just maybe. Just maybe. That was on a lighter note though. But dopamine is the neurotransmitter that makes you to keep wanting to do something. The neurotransmitter for addictions. That thing that secretes to your brain when you've played Bet Niger. I hope no one here bets. You play Bet Niger and you've won 1 million. It sends a signal to your brain. This thing is working. You go again. You win again. You go again. Exactly. You keep going, and it also controls libido. Right? You just keep wanting to do stuff because it sends a sense of, oh, I like this thing to your brain. Reward, that's the word, to your brain. Okay, you also have serotonin, your happy hormones. Sorry, your happy neurotransmitter, right? It spikes up when you are happy, when something just happened, and you're just everywhere. When it's low, you are very, 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 you're sad, you're depressed, and all of that. Okay, you also have your hormones, your oxytocin, your estrogen, and the rest of it. Okay, these things help. I'm talking about it because you might see someone, we had initially talked about mental health, right? Someone might be sad and all of that. Just don't, your first point of call, please, should not always be drugs. Your first point of call, I know why I'm saying this because, okay, prior to today, the Lord has said something to me. He had shown me green leaves and water. And this flyer represents it, sorry, the logo represents it. And like I said before, your body likes what comes from the ground because you were made from the ground. So anything aside that damages you. So you are also what you eat. You eat junk, you are junk. So you keep doing, okay, can I go take biscuits, can I go take Sprite? The next thing, you are everywhere. You are angry, you are everywhere. When you eat, your body knows you've eaten. Let me shock you. After the 30 days fast, I ate and I just slept off. Like, I slept like a baby. Because my body understood what I gave it. Do you understand? But when you keep eating biscuits, you are not even full. The next thing, you are looking for food. Because your body wants food. So please, let's give our body what it truly deserves. Your body does not deserve junk. When you eat junk, you give out junk. As simple as it is. So I'm just going to give, and please, 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 just like she said, as I'm rounding off, ensure, if you are a lady, I know every lady here is above 15. Please go for your pap smear test. Rule out cervical cancer. Every month after your period, 14 days after your period, please check. Go to the mirror and check. Later, I'm going to, maybe you can just walk up to me. I'll show you what your breast shouldn't look like and what it should look like. So that when you are checking it, you know what you're looking out for. Okay? So that we are on the safe side. And so that when the devil now wants to send a demon to latch on you with a disease, you cannot stand on the premise of the word of God because you've done the right thing. Now you are bold enough to say, Satan, get your hand off my property. Because indeed you are taking care of the property. You understand, ba? So with this, I'll give physiotherapist the mic to me.
I hope we are all learning a lot of knowledge to teach, a lot to give out. I think this one is for our men. Maybe our men should just gather. I don't know. They have been doing a lot for women since. So this is specifically for prostate health. So prostate health is, you find prostate in men. You understand? I actually made a picture of it. So prostrate, prostrate. I think I'm going to stand. Okay, so this is your prostrate gland. This this is your prostrate. It's a walnut size. Is do you know what a walnut is? Have you seen a walnut before? It's very small. This is 4 cm, 4 centimeters in the body. So it's just something small, but can actually when there is issues, it can actually lead to a lot. So and what are we going to talk about first? I think we're going to talk about male reproductive system first. So and in talking about male reproductive system, I think that's why we now talk about prostate gland. Male reproductive system has to do with um, those organs, your organs in the body that has to do with you urinating, you having sex, and also producing children too. So that is for men. Talking about men now. So and they're actually external organs and internal organs. So and when we talk about the external organs, we have the penis, you have your testicle, and you also have your scrotum. You understand? So then for the internal ones, you now have your bladder, your rectum. These ones inside. You see, it's inside your body. So you have your bladder, your rectum, your prostate gland, your ejaculatory duct, your all this, the epididymis, and all of them. So I think that is how it is. Then let's dive deeply into prostate majorly. So what is actually prostate health? The prostate is a small walnut-sized gland below your bladder. It's in front of your rectum. Okay, I think I didn't put it. So this no, go back please, go back please. So it's in front. This is it. Understand? It's in front of your rectum. Your rectum should be somewhere here. You understand? Then it's wrapped around the urethra. This is your urethra. This passageway you are seeing here is a tube. Your urethra. This is it. You understand? So you see it's wrapped around the urethra. So in passing, anything that happens to your prostate will actually affect your urethra. And this urethra is actually a passageway for urine. You understand? So let's be going. Let's be diving in small, small. So the functions of the prostate, as we know, is your prostate gland makes extra fluid in your semen. So it's not just for the passage of your urine. You also pass semen. Stand. These components they also help to nourish your sperm cells and your semen, and also the muscles in your prostate also help push semen into and through your urethra when you orgasm. So, what prostate problems feels like? What does prostate problems feels like? So, men with prostate issues often describe things like you are standing in front of the toilet for so many times and you are trying to urinate. Urinate here, itokoro. Ụfọdụ na-ada nakata ha edobe ofu ụkwụ na toilet sef. Na-eche the thing. You understand? So I don't know whether any of us have seen anybody, maybe your dad or maybe someone your relative or anybody, an elderly one. So this is how you say urine coming out weak. That is onaputa in tintin droplets. That is what you see, and it will be painful. You understand? And you are feeling like the bladder is never fully empty. You understand? So you in your time, you're gonna go get you can also. So these things happens that even when you want to sleep, there's that nocturnal urinating in the night. You always stand. Anybody that has prostate ill health, every time in the night, you understand? Because on a feeling that oh yeah, something is still remaining there. So and you have reduced semen volume. You understand? Because I said it's actually the urethra is actually where this thing passes. Your semen and your urine passes too. So and you have erectile difficulties because it's part of your male reproductive system. You understand? You want to have sex as a married man and you cannot have sex as a married man. So you can actually relate your problem to this. You understand? So what are the common prostate problems? The common prostate problems. We have one. I think you have to go to the next picture now. Thank you. So the first one is what we call benign prostatic hyperplasia or benign prostatic hypertrophy. Why we call it benign is that it has no metastasis. It's not cancerous. You understand? It's not cancerous. Cancerous means that it has not spread for now. It's still benign. I cannot go to forever. And hypertrophy means it is big, it's enlarged. Let's look at this now. This is your bladder, where your urine is being produced. So this is the urethra, where it passes it out so that you will now urinate as a man. So this is the normal. You see how this place is opened up. You see how it's opened up. When you have benign, enlarged prostate or benign prostatic hyperplasia, you see how narrow this place is. Because this is your prostate. It is now big. You understand? And there are many causes that can cause these things. This particular one, age. Because you rarely see it in people of our age. You understand? So it's more in, let me just say, 40 to 50 years. You understand? 40 to 50 years. And that is why you actually need to start checking on time. You have to start checking on time. And there are actually risks, like if it's in your family, you have to start on time. Like very on time to check it. If you notice maybe your dad or your grandfather, and please, you have to start having the test. I'll still talk about the test that you have to go on. Then the second one, go to the next slide again. Thank you. So there's something called prostatitis. That is inflammation of the prostate. You know what's inflammation? Inflammation. Like it, mama. Men like us not like it, mama. Please, mama, go and urinate. Go and urinate. You're actually taking a lot of problems to yourself. Go and urinate. Don't wait. I know a lot of things can actually cause you. Maybe saying you are in this or you are doing this, but please, it's good that you go and urinate. Please, because it can actually cause inflammation. You understand? And how you know that it's inflammation is that that area will start paining you. You understand? There will be irritation around that place. Do you understand? So that is an inflamed prostate. This is how it is. Are you seeing the redness there? So this is what is, and this is still enlarged prostate too. So for the last one, which is, go to the last. Thank you. So this is prostate cancer. We talked about benign prostatic hyperplasia. Understand? So benign prostatic hyperplasia can actually continue to, when you don't treat it, it can actually continue and it will now cause prostate cancer if untreated. You understand? So one of the most common cancers, it's one of the most common cancers in men. It's often slowly growing. And you will not notice the symptoms on time. That is one thing. You will not notice the symptoms. That is why I said, if it's in your family, start on time to start checking. That is one thing about prostate. So early stages may have no symptoms. Then advanced symptoms may mimic BPH, benign prostatic hyperplasia. The symptoms will mimic BPH. And the risk factors, as I said before, is increasing age. As you age, that is why you have to go and do the test. The name of the test is called PSA. PSA is the name of the test. It's called PSA, prostatic specific antigen blood test. It's a blood test. There is this, let's say, cliche or something about us men. We like hiding our problems. We don't like people knowing about our problems, especially when it's relating to this male reproductive. Especially, we hide it. We don't want to tell anybody, and you broke the thing by into your family. So it's a lot. So when you have something like that, you see, please speak up. It's good to speak up on time. Speak up. Go to your doctor, urologist. Go to the hospital and actually say, "Because we go to test that PSA test." PSA is actually a protein in your body. It drops in your blood. You understand? So when you are urinating and you start noticing it in large quantities, you understand? So that's why you need to. That means that you're having maybe a prostate issue. You understand? So that is why you need to go and do a PSA test. It's just a blood test. Or where are yours up? It's a blood test. Or where it doesn't take time. It doesn't take time. So in general, start screening around 40 to 50 years. So another thing that can actually cause it is hormonal imbalance. Hormonal imbalance actually causes this. You know, it's about just saw some wine and where hormonal imbalance, or they call you wine. Male, as you are growing, hormonal imbalance actually occurs. So as you are growing, so that is why there is this hormone called testosterone. We know testosterone now. The main male hormone. There's actually another one called the hydrotestosterone. You understand? As you are growing older, testosterone reduces. Then the hydrotestosterone starts working. So it's still sending those transmitters, still sending your every part of your body continues growing. Unlike some organs that stops growing, prostate continues growing. You understand? It doesn't stop. You get ahead. So that is why. Then if there is a family history of it, as I've said, then chronic inflammation and infection. Please, you don't need to actually cherum which way go just treat an infection, because some people will now say now you go to chop an infection, but I've heard some people say it not when we go can you treat an infection. You understand? Please, it's not so. Then sedentary lifestyle. You know what sedentary lifestyle is all about? You just sit down every time. Macandor fits people. You understand? People that like resting. Okay, let me not put resting as part as say people that like spiritual lifestyle is that you don't care about your body. Let me just put it out. You don't care about your body. You like enjoying life. You understand? Let's enjoy everything. You don't care to exercise. You don't care to do anything, and from then you start getting obese. You understand? So obesity is also a risk factor to it. So then unhealthy diet, as we said, smoking, alcohol intake, then poor urinary habits, as I mentioned before. Man, Mary, go and urinate. Jane your man, Mary. So that is it. Men should not fear screening. So how do you prevent? It's preventable. How do you manage this? Like, because we actually our main watchword is you have is prevention more. We don't want to come that is what you now start to treat. We want to prevent it more. So eat smart, as I said, grains, nuts, tomatoes. As nurse have said, please, you understand. So move often. Garia, you know that is good. You do bricks walking. There's something called bricks walking. Even if you cannot run, maybe you are. Bricks walking means walking fast. That's bricks. You know when you are walking so fast. You understand? You see men doing it. If you are always up in the morning, maybe you want to do exercise. You see men that cannot run. They do bricks walking. So treat infections early. Screen regularly. Then strengthen your pelvic floor muscles. If you want to do that, I think that should be a private one, and you understand. We can do that for you. Then there are some myths and cultural beliefs that people too. I think that is the one we should debunk for men. So too much sex causes prostrate is a lie. It's a very big lie. And not having sex causes prostrate is a lie. The both of them is what? A lie. Please, it does not happen. Or where he hate you. It doesn't even process, it does not happen. You understand? Never, my lord. So then there is one that we have to balance, because you start listening to people and they start talking about tight underwear is causing prostrate problems. No, you know it has to do with your scrotum. You understand? So your scrotal sac or your scrotum, it has to be cooler than your at least your body temperature, 2 degrees lower than your body temperature. You understand? So when you are wearing tight boxers, you understand, you reduce it. It doesn't affect because your prostate is inside your body. But your scrotum, as I mentioned, is an external organ. You understand? So it affects your external organ and not the prostate. You understand? So what else again? Okay. Then prostate disease. Some people say prostate disease. When you have prostate disease, there is now loss of manhood. You cannot do what you cannot do again. It's not so, please. It's not so. Please. So it's good that you abstain from all these things I've mentioned that can actually lead you to prostate issues. You understand? Then when you start having discomforts, maybe you did not, please go to the hospital. Seek medical help. That's why we are here as Havila. Seek medical help. We are not here for fans. You understand? We are here. Joy, we active. I the active. You understand? You understand? And your prophet, like nobody hears anything. And please go to us. Come to us, and we'll provide every management to your case. Then I think I will give to Ruby to now finalize.
Thank you so much. So just before we continue, if you have any questions, anything that is bothering you, anything at all, just you can write it down and give to any usher you see, or give to Sister Hope. Please, Sister Hope, can you stand? Thank you. Yes, she is, or Gold, any of the two. Please, you can. If you have any questions, you can write it down and give to them, and we'll try as much as possible to answer to them. So I'm going to be talking about resource compatibility today. Now, it's resource compatibility is basically it's something that's going to help us to I don't think there's anybody here now that's not looking forward to getting married. And if you're not looking forward to getting married, that is also very perfect. Yes. That is also very perfect. But just in case you're looking forward to getting married, this is something that you cannot afford to miss. Yes. Now, rhesus factor is an inherited protein found in the surface of the red blood cell. Think of it as if this is the red blood cell. Let me use sorry guys. Let me use if this ring is a red blood cell, there are dots all over it. That thing is a protein. It's called the rhesus factor. Do you understand? Yes. Now, rhesus factor now is basically if that thing is in your protein, if that protein now is in your red blood cell, it's positive. If it's not in your red blood cell, it's negative. Just take it like that. Now, this positive and negative, it's not as if it's bad though. You know, when we hear positive like this, it sounds like a bad thing. It's not a bad thing. But it's basically that time that you go for blood type test and they tell you, oh, you're A negative, you're A positive, you're O negative. That positive on top of that A is your rhesus. Is that clear? Yes. So now, how do we know that we are compatible versus compatible now with our partners or spouse or anything? So, this is very important because it has affected so many people, especially in childbirth. It does not affect the parents. Yes, it does not. It's the child now that is in the womb that it affects. So, because this is positive, negative, I'm going to please can I get one or two people, a boy and a lady and a guy, please, for this illustration, if you don't mind. Please, thank you. So I need a lady, I need a guy for this illustration. Our lady is shy. Okay. So now, this is a guy and this is a lady. We're going to assume that they are both positive. Now, he is, do you mind telling us your blood type? Oops. Okay, I'm going to give him a blood type now. He's O positive. She's O positive. What are they both? Positive. Can they marry? Yes. Even if we'll keep going, shall you understand better? Now, positive, they are compatible. They can go. Positive, negative. Now he's O positive, she's A negative. Can they go? Yes. I'm going to explain why they can go. How do I make this thing better now? Okay. Let me understand it like if the woman does not have it, that means she's what? Negative. And the guy has it, he's positive. If they are trying to have a child or they have it, most times it does not affect that first child. They can give birth freely to the first child because a baby's blood does not mix with the mother, but most times 75% of the baby's blood is coming from the father. Yes, the sperm contributing parent gives 75%, while the pregnant parent is giving more like 25%. Yes, so most times it's always the guy. So if he's positive and she's negative, what is their child most likely to have? Positive. Thank you. Yes. So he's positive, she's negative. Now their child is obviously what? Positive. That first child now, they can give birth freely to that child and nothing happens. But one thing we must note now is that they cannot adequately have a second child. Why can they not have that second child? The sperm has been introduced to this woman's body and they've seen that, oh, something foreign entered this body. Oh, our body is very sensitive. Something foreign has entered this body. What do? The body start building antibodies. Yes, they start building antibody because they want to do what they want to protect you, not knowing that this they don't know the one that is good and the one that's the same thing that nurse mentioned when she talked about chemotherapy. When chemo is dealing with cancer, it does not know the cancer and the normal cell. It's dealing with all of them. Do you understand? That is why it's when you see chemo patients, there's so many things going on with them at the same time. The same thing with this one. So the body does not know that this is a good, it's not a problem. So what do? They build that antibody. Now when they want to try to get pregnant again, he's positive. Remember now he's positive, she's negative. When they go for it, the body recognizes that first one that entered, and what do? They fight against it. So you see that they're always miscarrying their baby, there's always miscarriage, so when they miscarry that baby, is it that most miscarriages are like the extreme? Sometimes they actually do carry, but when you give birth to the child, it's stillbirth. That's the problem. Imagine you carry a child to term, and what do you hear? Your child is dead. That's not a good thing. Sometimes the child comes up with so many bad conditions. Maybe their liver is not properly formed, their heart is like this. There are so many conditions that the child will not survive the first few days, and that is bad. So what do we do in this case? There's a vaccine that they give. It's called the Rogam. It's called a Rogam vaccine. If he's positive and she's negative, when she's 28 weeks pregnant, hmm? Yes, with the first baby. When she's 28 weeks pregnant with that her first baby, she must have. These are the tests that one of the things they run during antenatal. They would have confirmed her blood. That sometimes they even go genetical to check the baby's own. Yes. So they've confirmed that she's negative. What they do now is that at 28 weeks they give her that immunoglobulin vaccine now. They give it to her, and it can stay in her body for at least 13 weeks. By 13 weeks, her pregnancy has come to full term, and she probably would have given birth. If it has been confirmed that the baby now is positive or negative, if it has confirmed that the baby is positive, she must take that second dose of the Rogam vaccine between 72 hours of birth. And this is not, once you take it, it does not mean that you can now continue giving birth like that. When you want to have the third child, you continue that cycle again. So if you check all these things now, you see that it is better off that you just marry someone that you are compatible with in that essence. Now, how do we know people who are compatible with? Plus, can they go? Minus, can they go? He's minus, she's plus, can they go? Yes. Why can he go now? He does not have it. He's the sperm contributing parent. So when he introduces it to her body, she already has it, so there's nothing happening. Do you get it? She has it now in her own DNA. So he does not have it. He does not have it. So if even anything he's giving her, they don't know that anything happened because it is present in her own body. And if he's negative, she's positive, what is the child most likely to be? Negative, because he has 75% contributing factor. Do you understand it? Yes. So how many weeks, if he's positive and she's negative, how many weeks do we take the Rogam? 28 weeks of pregnancy. And if it has been confirmed that the baby is positive, under how many hours? 72 hours. What's 72 hours? 3 days. Please, within 3 days, she must, if not the next pregnancy, you can, no two ways about it. They will always, I've seen so many old age couple, and you see them, they have one child. It's not because they wanted to have one child. It's because they didn't know better. The rhesus incompatibility was a problem, and it continued like that. Thank you so much. So, yeah? Okay, yes. So we're going to be talking about essential premarital tests. This one now is one. Genotype is another. I like to think that it's a subject that is very well, we are familiar. Okay.
Sorry. Can we wrap up in 3 minutes? 3 minutes. Because there are other. Let's just do 3 minutes. You are supposed to have finished by 7. I'm enjoying this section. Maybe we'll plan, something else. Maybe one Thursday service. We'll just dedicate it to this thing. All right. Because I'm learning a lot. Believe me, those who are not here, I feel sorry for them. Sincerely. And if you're here, you've not been paying attention, I really feel sorry for you. I feel like these things are very, 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 very vital. And we play a lot. He'll wrap up now. I was listening to Pastor Chris Akilome one time, and he said that if only people took a lot of water, most of the people who come for miracles to receive healing during, maybe night of healing and all of that, say most of them will not even be sick in the first place if only they took a lot of water. I mean, there's just a whole lot that's been said tonight, and I sincerely wish we had the time, but because of preparation for Thanksgiving tomorrow evening, we're trying to get some other things done. Please forgive us, but just wrap up in 3 minutes so that we can get other things done.
Okay, I'm going to wrap up with this. Essential tests to be done. We have HIV and AIDS, genotype screening. We are very familiar. So AS, no matter how much you love that bubble, please cancel carbo, break up, or you will be fine. I can assure you, you will be fine. Yes. Hepatitis B and C, very important too. STD, syphilis, gonorrhea, all of those things, check them. Yes. And blood group compatibility. This one now we just finished talking about that. It's very important. Now, all these things are to ensure long-term health and family planning. Some other crucial tests now that you can also add to it. We have things like fertility screening to check if, fertility, impotence is not only the woman. Sometimes even the guy. He said something about the scrotum and all. Some people have worn so much tight clothing that it affected the scrotum, and then it was a problem to give birth in future. Because you see some guys now, there are issues of low sperm count. That's a problem. These are adverse effects of some of these little things that we ignore. Sometimes sitting on hot surfaces for so long, when you're always sitting at a spot for so long, it's a problem. Free yourself. When you're at home, wear something. I don't know what don't you get? Yeah. So please, yes, genetic disorder tests. Go inside that. There are so many genetic tests. Go and run those. Check that their family is okay, and all of those things. Mental health as evaluation, Bikono. So many people that we don't know are moving mad. Yes. Please, madness is not only when they are dancing on the road. Some people actually are mad. Yes. So please check some of these things. One of the things they will tell us when we're in psychiatry, to an extent, everybody has but there are people's own that is above, and you cannot manage that above, I can assure you. Yes. Yes. And all these things are to address potential future complications. You will cry later, so check it now. Open your eyes. Love is not blind. Because thank you. Thank you so much for listening. Thank you.
Wow. 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 Have you been blessed? Should we have this another time?